This segment of DelmarvaLife is sponsored by TidalHealth.
When it comes to personal care created around your needs, a doctor who knows and understands your situations is vital. And that's where your TidalHealth doctors come into play. You're not just a number, you're not just a chart, you're a human being with specific needs, and they do their best to get us familiar with what your needs are as they can.
So joining us this afternoon is Dr. Edward Dunn. He is specializing in palliative care. Thank you so much for joining us this afternoon.
Thank you.
We were talking a little bit before we got started here, and you just recently came to
Correct.
Delmarva.
Yes.
What brought you here?
9 people named Dunn who are my grandsons.
That would do it, wouldn't
Yeah.
it?
Yes, 2 in D.C. and 7 in Wilmington, North Carolina.
And palliative care with TidalHealth is a passion of yours.
Yes.
One of those.
Yes,
okay.
it is.
And many people think palliative care is only for end-of-life situations, but can you clear up some misconceptions with that?
The way I describe that to patients is there's a tent called palliative care. The term palliative, which nobody knows what that means,
Yeah.
it comes from a Latin root word palliare, which means to cloak. Pallium is the cloak the Pope wears, for example. So it's not a
Okay.
stretch to think that if you cloak somebody, you comfort them.
Right.
And so a lot of palliative care programs, some palliative care programs around the country have been renamed supportive care, just so people kind of know intuitively what that means. What do? We help people deal with chronic life-limiting disease, and we help the death and dying, but hospice is a small corner of that. We're the bigger tent. The hospice is a smaller one inside that tent. We co-manage patients who have cancer, heart failure, chronic lung disease, and help them continue to live until they die, not prolong the dying moment.
Right. Okay. So let me ask this: How do the people in your team work alongside the specialists with a patient and their care?
Oh, for example, somebody with cancer, we co-manage their symptoms, especially cancer pain. But we look at it from not only just a physical or physiological perspective, which is what I'm trained to do as a physician, but we have a social worker who looks at the patient's socioeconomic needs, community needs. Some our social workers are therapists, help them deal with their personal challenges in life, and the psychological aspects of care that sometimes we don't pay a whole lot of attention to, but people need time, and the most common critique, I think, in medicine today is there's so much time pressure. You hear it constantly from people, well, my doctor didn't have enough time to spend with me. That's all we do is spend time, and we listen a lot and try to help people think about their lives in the context of their medical condition.
So these are some great ways that this type of care can help improve their quality of life.
And we're focused on quality of life. And so we're trained as physicians and nurses and nurse practitioners and anybody in allied health to try to prolong life, but not at the cost of human suffering. And so the quality of life is really what we focus on. And that's what hospice focuses on. Well, our partner is Coastal Hospice.
Right.
We have a great relationship with them. And we refer to them commonly, almost daily. And they're a wonderful organization. And together we hope people actually live until they die, rather than, as I said, prolong the dying moment.
I like the way you say that. Now,
Yeah.
let me see if I can twist this and say it correctly. As you mentioned, a lot of people don't understand or know what palliative means. What would you suggest to a family who is considering palliative care?
Make an appointment.
Yeah.
Come see them.
Ask questions?
Yeah, we have a team. And we have also, I didn't mention chaplaincy. It's a very important part of our team. We have a multidisciplinary team that basically, the metaphor I like to use is if the patient is in the bed, sick, and surrounded at the bedside by family and friends and significant others, our metaphor is we put our arms around all of the family around the bed with the patient in the middle. Because our theory is if we help families and significant others care for that patient, the patient will get better care. And if they understand what the patient's going through, there's less fear because people are beginning to understand what the individual is dealing with. So commonly in our society, people don't talk about death and dying.
Right.
They run away from it. And I think dying is part of living, and we just try to help people, as you said, focus on quality of life.
Your arms around the family with the patient
In the middle.
I love that.
I love
I've never
it.
heard it put that way. Doctor, thank you so much for joining us this afternoon. It's wonderful talking to you. Dr. Dunn with TidalHealth.